Welcome to this educational program. This module provides an introduction to the prostate and certain common prostate problems. This material is independently produced and is intended for information purposes only. No attempt is made to provide opinion or recommendations. The prostate is a chestnut-sized gland situated in the pelvis at the bottom of the urinary bladder, the place where urine is stored. It sits next to the rectum and surrounds a portion of the urethra, the tube that carries urine from the bladder out through the penis. This is another drawing showing in 3 dimensions how the prostate surrounds the urethra at the base of the bladder. This drawing highlights how the prostate is associated with the male reproductive tract. Sperm is made in the testicles and travels through the sperm duct or vas deferens and into the ejaculatory ducts. It then mixes with fluid from the seminal vesicles and prostate just before ejaculation, where the semen is released at orgasm or climax. During orgasm and ejaculation, semen passes out of the body through the long tube within the penis called the urethra, which is also the tube that urine passes through. The prostate has 2 important roles. It is a muscular gland, and these muscles can have a gripping or squeezing effect around the urethra. As such, it plays some role in helping to control urine flow and prevent leakage of urine out of the bladder. More importantly, the prostate functions as a male sex gland. It secretes a thin, milky fluid into the semen that nourishes and helps activate sperm cells by liquefying semen after climax. This frees the sperm to travel towards the female egg for fertilization. The substance within prostate fluid that performs this function is a protein molecule called PSA, or prostate-specific antigen. PSA is an important protein because some of it is also released into the bloodstream and can be measured in the blood to give doctors an idea of how active the prostate is. As one of a man's sex glands, the prostate is affected by male sex hormones, which stimulate the activity of the prostate and the growth of prostate cells. The chief male hormone is testosterone, produced almost entirely by the testicles, with a small amount also produced by the adrenal glands, just above the kidneys. There are 3 main causes of so-called prostate problems. Non-cancerous enlargement of the prostate, called benign prostatic hyperplasia, or BPH, inflammation of the prostate, called prostatitis, and prostate cancer. These conditions are discussed in detail in separate presentations available through your doctor's office. Ask your doctor if you are concerned about any of them. This slide shows graphically the differences between these most common prostate conditions. Compared to normal, in BPH, the prostate is enlarged in size, while in prostatitis, the prostate is inflamed and swollen. In prostate cancer, cells can grow uncontrollably to form tumors within the prostate. Many other conditions of the bladder and urinary tract can cause symptoms which mimic prostate problems. This slide lists some of the most common ones. You can see by this list that your doctor has a number of possible conditions to keep in mind when evaluating your symptoms. A man with a prostate condition may feel the need to urinate frequently, or he may have sudden urges to urinate. His sleep may be disrupted from having to wake at night to empty his bladder. He may strain to begin urinating or have difficulty completely emptying the bladder. Finally, the urinary stream may be weak or slow to start, and there may be dribbling of urine afterwards. Together, these symptoms are referred to as lower urinary tract symptoms, or LUTS. Your doctor can use several methods to diagnose BPH. First, you will likely be asked about your medical history and may need to answer a short questionnaire on urinary symptoms. The doctor may perform a rectal examination, feeling the prostate gland with a finger to check its size and condition. Occasionally, an ultrasound may also be used to help estimate prostate size. You may require a blood test and a urine test, and you may be asked to urinate into a special toilet that measures the rate of urine flow. The digital rectal examination, or DRE, is a simple but critically important test for a man to undergo in order for the prostate to be properly evaluated. The prostate gland sits next to the rectum, so by passing a finger into the rectum, a doctor can feel one surface of the prostate and can roughly assess its size and consistency. He or she can also evaluate for tenderness in the prostate and for the presence of prostate lumps or nodules. While many men may dread this examination because they find it uncomfortable, it is not a painful exam and is not dangerous in any way. As mentioned, PSA is a protein made by the prostate and released into the semen fluid and the bloodstream. The test used to detect PSA in the blood is very accurate, and PSA therefore provides an excellent marker to measure the activity of the prostate gland. PSA is used to screen for prostate cancer, and it also has an important role in monitoring men with prostate cancer and other prostate conditions, and for following the effects of treatment. There are some controversies and important issues around the subject of PSA screening, and this should be discussed carefully with your doctor. PSA is discussed in greater detail in its own separate module. There are certain lifestyle changes which may ease the discomfort associated with prostate conditions. It is thought that reducing caffeine and alcohol intake, smoking cessation, reducing fluid intake at bedtime, maintaining a healthy weight, and staying physically active can offer some symptom relief. Most men should see their doctor to have their prostate evaluated at least annually for an exam, and PSA if recommended. They should also visit their doctor when urinary symptoms persist despite making appropriate lifestyle changes, or if they have a strong family history of prostate cancer. In summary, the prostate is a small gland at the base of the bladder, surrounding the urine channel or urethra. It has important roles in controlling urine flow and fertility. Growth of the prostate is stimulated by the male hormone testosterone. Evaluation includes a medical interview, digital rectal exam, or DRE, and a blood test called PSA. Lifestyle changes can improve prostate symptoms. Good treatments for prostate conditions are available, and your doctor can help. This slide lists some of the many resources available where you can find more information about the prostate and prostate problems. We sincerely hope that this module has furthered your understanding of the prostate and prostate conditions. For more information on prostate conditions, please see your doctor. Other modules are available through your doctor's office that discuss these conditions in detail.